Okay, so let's take some time to go over both the kidney model as well as your kidney dissection. So on the kidney model, you need to identify one of the layers, which is the cortex, and as you know, the cortex is just that outer layer of the kidney. So everything in this area here, and it continues up around, is called the cortex of the kidney. Okay. The structures, you see one here, and these are cross sections here, and then these are the full sections 1, 2, 3, and 4. Those are the medullary pyramids. And then the medullary pyramids, at the points of each of the medullary pyramids, you can see them here, and these are obstructed by other structures, and I'll talk about that next. But these points, these are called the papilla of the pyramids. So again, your medullary pyramids and the papilla of the pyramids, or papilla, however you want to pronounce that. Okay. The papilla, you'll see that they sit inside of this structure, and this is a cross section here. This, it looks like a tube. It's a little lighter colored tube here, 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 and here. You have to identify those, and those are each called a calyx, C-A-L-Y-X, calyx. And then another area of the kidney that you need to identify is this area, this open area in here, and this is called the renal pelvis. Okay. All the fluids collected in the renal pelvis are going to be dumped down the ureter, and that's what this tube is here. This is the ureter. Okay. Next, we'll spend some time talking about the blood flow through the kidneys. And so we're going to turn it around so we can see the outside of the kidney, the exterior view. And the first blood vessel that you need to identify is a red blood vessel here, and this is the renal artery. Now, the renal artery on this model, it's only going to be from this segment to just about here. So between these two pointers, or my finger and the pointer, this is the renal artery. Once the renal artery starts to branch, so you see there's one branch that comes in this way, and then another one here and here, those branches are called segmental arteries. So again, from here to here, and it continues this way, is the renal artery, and then once the renal artery branches, it's called the segmental artery. Okay. We're going to make our way back inside the kidney, and we'll focus down in this area. It might be the easiest to see. So the first area of an artery that we're going to talk about is this straight run that comes this way, and this is called an interlobar artery. The interlobar artery continues, and then it starts to curve around, and at this point it's called the arcuate artery. And the last arteries that you need to know of are these. Some people say they look like eyelashes coming out this way, and those are called the cortical radiate arteries because they're radiating into the cortex. So they're cortical radiate arteries. We're going to come down here and we're going to talk about the veins next, and we'll do it in reverse order. So again, when the blood's coming from the cortex, the first ones we have, again, they look like those eyelashes. These are cortical radiate veins. And then again, these nice curved segments here and here are your arcuate veins. And then again, the more straight runs of those same veins, those are called your interlobar veins. And then once we come back out here again, you'll see that out here we have our renal vein. Okay, so that takes care of the kidney model. And now we'll just talk briefly about the kidney dissection, because there aren't as many things to know about on this, but you'll see the similarities. That's why I wanted to go through the model first. So again, we have a cross-section here of a kidney, and you'll see that just looking at the color of the kidney itself, you'll see that from my pointer towards the outer surface, you'll see it's a lighter color than from my pointer towards the middle of the kidney. So this lighter area, this lighter shaded area that runs all along the outside is going to be the cortex of the kidney. The next thing that you need to identify on the dissection, again, are the medullary pyramids. You'll remember on the model itself, they actually look like pyramids themselves, and you'll see that the medullary pyramids, again, we're going to be going into the medulla area, so it's a darker area, and we are going to look for those nice points. So there's one here. Okay, I'm going to go to the other side of the kidney. It might be easier to see. There's a nice one right here, this point. So this whole segment coming up here is a medullary pyramid. You'll see another one up here. And then we'll come over here, we'll just point out one more. So those are the medullary pyramids. Like we talked about in the model, the point of the pyramid is called the papilla of the pyramid. That's not something that you need to identify on this, but I wanted to just use it as a landmark because in the model we talked about the papilla of the pyramid sitting inside of that calyx. And so the calyx, you'll see, if you see the lighter colored tissue here, how it's surrounding the papilla. So the lighter colored tissue, that would be the calyx that we're looking at. In the model we talked about all of the areas of the calyx coming into and coming at the common area, which would be located here. All the fluids would be collecting and coming together in here. And this was the renal pelvis. It's this area on this side, and on this side it's this area in here. And then from the renal pelvis we talked about the one tube that was leaving the kidney, and that was the ureter. So you'll see the renal pelvis here. Yep, the renal pelvis. And then the tube that's leaving the kidney, which I'm picking up on right here, that would be the ureter. And that is going to complete the kidney model and kidney dissection.